Our ability to manage pain has improved so much over the last 10 to 15 years that the vast majority of shoulder arthroplasty now is done as an outpatient procedure. One of the interventions that has been incredibly helpful in allowing that to happen is a regional nerve block that's administered by the anesthesiologist right before we go back to surgery. The benefit of the block is we can give them a very, very light general anesthetic with no narcotics added. That makes a huge difference in how quickly the patient wakes up. They really become alert within the first 30 to 45 minutes, and they don't have any pain at all. The biggest focus in the first 24 hours is to make that transition period for when the block wears off as smooth as possible. The block lasts for 16 to 18 hours. Pain medicine is started the night of surgery before any pain even starts to happen. This regimen has created a very, very smooth and efficient way that's very, very comfortable for most patients. There's been excellent studies as well looking at the safety profile of outpatient versus inpatient shoulder arthroplasty. There's no difference in complication rates. Patients in general are very, very pleased not to spend a night in a hospital. They're more than happy to be done as an outpatient category.